Her father was extremely physically abusive. They also were homeless, going from place to place to place.
She experienced physical abuse and neglect.
We learned together that in a previous home he had lived in, that cold showers were a form of punishment.
She felt in danger herself, and she felt in danger of what might happen to her family.
Her mom was really controlling and often had a lot of body shaming towards her, which happened to have the client develop an eating disorder.
She went into her room, locked the door, and took 2 bottles of pills.
This is a kid who hasn't yet been given a chance, and her world keeps telling her that nobody's going to.
A child who has experienced 4 or more traumas is 12 times more likely to, at some point, attempt suicide during their adulthood. The children we serve at Navos are usually struggling with a tremendous amount of poverty.
Physical abuse, sexual abuse.
The child, again, not be given meals at all, let alone nutritious meals.
They're coming because their family's experiencing homelessness.
Broken families that have a high risk of abuse and substance use.
So when we see children who have experienced trauma, they are exhibiting depression, anxiety, hyperactivity.
They've never been given the support and the skills and the nurturing to be able to manage the cards that they were dealt.
The ability to survive is something that day to day, week to week is a concern. And so a person's ability to thrive just seems so far for them quite often. The first thing that we can do as caregivers is provide compassion.
At Navos, we start with asking, what happened to you? We don't ask, why are you behaving this way? Why are you acting out? What's wrong with you?
We're not treating the symptom, is that we're treating the person. So now what we want to do is make sure that we're instilling hope and that we're helping them build their self-esteem.
I want the kids to leave our program knowing that there are people in the world that care about them.
Know that repair is possible, healing is possible, and recovery is possible.
I stay hopeful because there are people who are truly committed to supporting these kids.
This is important and urgent work because we know that children in Seattle and King County are suffering right now.
If we don't address this issue and help these kids now, they will continue to live on the streets. They will continue to use drugs and alcohol. They will continue to suffer from the trauma that they've experienced.
There's a high chance that these children can end up in long-term psychiatric hospitals. They can end up in the criminal justice system.
The problem would grow so big that it would overwhelm everyone. It would impact every system and every community.
And if we aren't providing care now, it's only going to get worse. And it's not just going to be an individual issue. This is going to be a social and community issue that's going to last for years and years.
This work is important because it saves lives.
Because nobody deserves to be suffering by themselves.
Because our kids deserve to live, and they deserve to live happy, full lives.
And Navos is a place where anyone can come through the door and be seen, be heard, be supported, and met with compassion.
When you help Navos, you're helping children see a different future for themselves.
With Navos, healing happens, relationships are restored, and our community is stronger.
This work is critically important, and if we don't do it, who will?
Who will?